cigarette smoking is responsible for more than 480,000 deaths per year in the United States, including more than 41,000 deaths resulting from secondhand smoke exposure. This is about 1 in 5 deaths annually or 1,300 deaths every day. On average, smokers died 10 years earlier than non-smokers. The recent pandemic has forced everyone to wear masks. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and today I'm going to discuss about how smokers who smoke and wear masks are more prone to its harmful effects. Smoking traditional or non-combustible cigarettes while wearing a surgical mask results in a twofold rise in exhaled carbon monoxide and impaired blood vessel function compared to non-mask periods. That's the finding of research published in the European Journal of Preventive Cardiology or Journal of the ESC. The study focused on traditional, that is combustible cigarettes and non-combustible cigarettes, also called heat not burn or heated tobacco products. The researchers investigated the levels of exhaled carbon monoxide in smokers while wearing a mask during working hours and compared it to carbon monoxide levels during days off without a mask. In a second step, the researchers examined whether the change in carbon monoxide exposure was accompanied by impaired blood vessel function. The study included 40 smokers of conventional cigarettes, 40 exclusive heat not burn cigarette users, and 40 non-smokers with similar age and sex who were medical personnel in a university hospital. Individuals with known cardiovascular disease, hypertension, diabetes, dyslipidemia, chronic kidney disease, or atrial fibrillation were excluded as these conditions may affect vascular function. A similar number of combustible or non-combustible cigarettes were smoking during mask and non-mask periods. In conventional cigarette smokers, exhaled carbon monoxide increased from 8 parts per million at baseline to 12.15 parts per million with no mask and 17.45 parts per million with a mask. In non-combustible cigarette smokers, exhaled carbon monoxide increased from 1.15 parts per million at baseline to 1.43 parts per million with no mask and 2.20 parts per million with a mask. Among non-smokers, exhaled carbon monoxide did not differ between the baseline, non-mask and mask periods. In both combustible and non-combustible cigarette smokers, all vascular markers were higher while wearing a mask compared to the no mask. In non-smokers, there were no differences in vascular markers between the 3 periods, the researchers concluded. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.